corona is in Africa, in this vicinity, about 30 people are supposed to die to make me convinced.
Cases of coronavirus are on the rise across Africa.
I don't feel powerless.
But in some countries, people don't believe the pandemic is real.
They're lying because I've never seen someone that have the coronavirus in this Nigeria.
The hospitals of Nigeria's most populous city, Lagos, tell a different story.
It would have been fun if it wasn't so devastating.
We were granted exclusive access to a coronavirus response team at the Lagos University Teaching Hospital. These are the doctors and nurses on the front lines.
I was good as dead. I thought it was all over.
Lagos, the commercial capital of Nigeria and home to around 20 million people. The country has 30,000 confirmed cases of coronavirus. A third of those are here. Now, after a month in lockdown, Africa's most populous city is opening back up. But the virus shows no signs of slowing down. Nigeria's climate is hot. Spending hours on end in protective equipment isn't easy, but the wards are filling up and staff here have no choice. We're now on an isolation unit at the Lagos University Teaching Hospital. Anyone who tests positive for coronavirus is treated here.
Let me check your oxygen levels.
Dr. Akase is treating a 75-year-old man who collapsed at the hospital during a routine procedure. It turned out he had COVID.
If you see the forward, now people come carry me off. You think they boom.
He's one of our severe ones that we're paying very, very close attention to.
Dr. Akase hasn't been home in 12 days. He's so busy he has to sleep in accommodation on hospital grounds. Successive governments have been accused of underfunding healthcare in Nigeria. Ask doctors here and they'll tell you COVID is putting strain on a system already stretched thin. But there's another factor adding pressure to the fight against the virus. People are dying because they aren't coming to the hospital for testing or treatment in time.
Always, rolling back, thinking, okay, if we had this, or if we had done this differently, or if this person, if he had come earlier. But there's a sense also of anger. Why didn't he come earlier on? Why did he come so late?
Fake news circulating online means many Nigerians don't believe the virus is real or think the scale is being exaggerated.
This is the isolation center of Kano. Nobody is inside.
This video went viral.
So they say that we have about 800 people. Where are the 800 people here?
It claims to show an empty isolation center that was meant to be treating COVID patients. The government labelled it misleading, but many Nigerians remain sceptical.
Isolation center, people are dancing, eating, there's no corona. I saw it on YouTube now.
But we have not seen anybody when they show you that coronavirus is real. It's not real. They are using it to defraud the masses that we are already suffering. Coronavirus is in abroad, not here in Africa.
No one that we spoke to was wearing a face covering or a mask or was adhering to social distancing. And as the numbers continue to increase, things like this are a big concern.
It's not just among street people, ignorant people. You have seen this among educated people, people who are well-traveled. It will complicate efforts to curb this in our country to a large degree. Sorry, look to it.
Despite the disbelief outside, inside the hospital, the impact of the virus on Dr. Akase and his patients is very real. This woman lost her sister to COVID, and now she and her nephews are infected. She has no idea when she'll be able to bury her sister.
My sister is the closest sister I have in Lagos. She's gone. I've not buried her yet. I don't know what there's hope for me. I don't know.
I'm so sorry. Until now, Africa has been behind the curve, but that's changing. The pandemic yet to reach its peak. And already, staff here carry the weight of what they see with them.
When you're going home, you're thinking, okay, so this, should we have done this? Of course, then there are those that died, so you get to carry that with you.